Inside the UC San Diego Emergency Department in La Jolla, a new wing specially designed for seniors 65 and older.
Soundproof walls, better lighting. The beds are much more comfortable for prolonged stays if seniors need to be in bed for a prolonged period of time.
Here, there are no noisy machines, glaring lights, or slippery floors. Rather, an ambiance of comfort, calm, and healing. Dr. Vishal Tolia is director of the Gary and Mary West Senior Emergency Care Unit.
We are now seeing almost 35% of our patients over the age of 65. And so what we've realized is that that population, similar to the pediatric population, has very specific needs.
And it's a population that's growing rapidly. The State Department of Finance estimates the number of Californians 65 and older will climb by 2.1 million in the next 7 years. By 2030, the number of people 65 and older is expected to double in San Diego County. Dr. Tolia says that means more seniors coming to the ER who often have multiple symptoms and require complex care.
They can present with infections, not with your typical symptoms that a younger adult would have, but weakness, dizziness, confusion, things of that nature. And oftentimes, those vague symptoms don't really require an admission to the hospital, but require some upfront specialized care.
The senior patients are treated by a team of doctors and nurses with special training in geriatric medicine.
So they look for things like fall risk, depression, cognitive impairment, review of medications. They work with physical therapy, pharmacy, and all these other services that we bring to the emergency department.
The goal is to avoid unnecessary hospitalizations and readmissions, and instead provide a full assessment and treatment, followed by a safe transition to a home environment with proper resources. The geriatric unit is funded in part by a $12 million grant from local philanthropists Gary and Mary West. Their foundation and nonprofit West Health plans to use the facility as a model.
We're really excited about being able to populate this throughout the state of California and then taking the best practices and implementing them in different medical centers across the United States.
The senior care unit currently has 12 rooms with plans to open 8 more this year. Susan Murphy, KPBS News.